Making a difference in healthcare requires collaboration between researchers, startup founders, and policymakers. This is what Delta is about, hosting conversations with leaders on the path to serious innovation. Hello everyone, my name is Roupen, and I'm a physician on a journey to meet people who are making a delta in healthcare. Hello everyone, and welcome back to a new episode of Delta Health Tech Innovators. Today we're going to break down complex healthcare concepts through a series of episodes that I'm going to launch. I want to make it easy, bite-sized insights. My name is Roupen. I'm a hematology oncology physician. I'm very interested in innovation in healthcare, and I want to move healthcare forward. And I believe in the power of startups and research. Startups are very important in healthcare. So I want to create this platform and small bite lessons to help startups, especially people who have tech background, to understand healthcare better so they know how to help and improve and empower healthcare. Today, we're going to dive deep into the world of fee-for-service payment models. Understanding the payment model is very important to get reimbursed. And if you don't get reimbursed, you can't survive. You don't have a business if you don't have an income. So understanding the payment models and how the payment models work in healthcare is very, very important. We're going to talk about the payment models, we're going to talk about the coding systems, and we're going to talk about other things we're going to discuss further. So whether you are a seasoned healthcare entrepreneur or just you're starting your journey, right? Understanding how healthcare services are paid is very crucial. So let's get started. Imagine you're walking into the doctor's office and receiving a bill. The bill says like medical service rendered, and there's like a $50,000 charge. What does that mean? Like, why $50,000? What happened? So it's not very informative, right? So that's where coding system come into play. But before we go into the codes, let's understand what's the fee-for-service model is and how this model that mostly dominates healthcare payments today works, although this model is being replaced as we're going to see. So what is fee-for-service? Fee-for-service, its providers are paid for each service or procedure they perform. It's just like a la carte menu. You pay for each item individually. The system uses specific codes to identify the services provided, which then determines the reimbursement amount from the payers like Medicare, Medicaid, or commercial insurance companies. Let's go to the mechanic. If we go to the mechanic, you will better understand the fee-for-service. To make it more relatable, let's go to the mechanic. When you take your car to the mechanic, you pay for the parts you need. Like, let's say you need a new brakes, and then there will be some labor to install them. So the repair shop will charge you a bit more for the parts and to cover the labor and also to cover the overhead costs and make some profit, right? You might shop around to make sure that you are getting a fair price. And sometimes you might find bundle deals that include part and labor at a fixed price with a quality guarantee too. So in this scenario, paying per service works pretty well because you understand what you are paying for. You're buying brakes, you're paying for the labor, and they will make some profit. But when it comes for fee-for-service in healthcare, it doesn't really work in the patient's or in the system's best interest all the time. Because providers or physicians are paid for each service, so there is an incentive to order more tests, do more procedure, and see patients that don't need to be seen. So this is known as also defensive medicine. So this can lead to higher cost of healthcare without improving patient outcomes. And this is one of the reasons why the cost of healthcare is rising. So how did the coding system start? So how do providers communicate their services? And instead of going to the physician and getting a bill of $50,000, how would the provider tell Medicare, Medicaid, or other insurance companies, we did this service, we did that procedure, and that's why we need X amount? So if you go back to the 1960s, at that time, with the introduction of Medicare and Medicaid, more healthcare services began to be paid by also third-party payers. So this led to development and increased focus on standardized coding systems to identify diagnosis and services rendered. So important coding systems that you need to be familiar about: CPT codes. You're going to be asked by venture capitals or like other healthcare investors or angel investors, do you have CPT codes? What does CPT code mean? CPT code means current procedural terminology. This was developed by the American Medical Association. CPT code describes a medical, surgical, diagnostic service performed by the physician. They are updated annually, of course, to include the new services and procedure. Let's say there's a CPT code for a mental wellness app. Let's say there is a CPT code for a new device or a new procedure. So, and that's what usually insurance companies and Medicare and Medicaid use with new startups as they bring new devices or there are new surgeries or procedures and stuff like that. Now, the other type of codes is ICD-10 codes. ICD stands for International Classification of Disease, 10th revision. So ICD codes identify specific disease or injuries. Some countries moved to ICD-11. In the United States, we still use the ICD-10. So ICD is for diseases, CPT is for procedures. And then we have the HCPCS or HCPCS codes, Healthcare Common Procedure Coding Systems. These codes cover non-physician services like ambulance rides, prosthetics, durable medical equipment, and stuff like that. Then we have the NDC codes, or what is known as National Drug Codes. These unique identifiers are used for prescription drugs approved by the FDA. So how does reimbursement works? When a healthcare provider submits a claim, they use these codes to detail what services they provided and why. For example, if they see a patient with heart failure and they, let's say they put an defibrillator. So there is a ICD code for heart failure and there is a procedure code for putting a defibrillator in this patient that is CPT code. Let's say the patient also came emergently to the hospital, so the hospital is going to use the HCPCS code. So that's how these codes work. But also there are some variables that can affect the reimbursement. For example, provider type. Physicians, nurses, and other medical professionals will get reimbursed differently for the same services. It depends who provided the service. If a physician sees a patient, they were going to be paid differently when compared to a nurse seeing a patient. The other important variable here is also the location. A physician who is seeing a patient in New York is going to be paid different than a physician who is seeing a patient in Detroit because of cost of living. The third thing is the payer. It depends who is paying for the physician or the hospital. The rates paid by Medicare, Medicaid, and other commercial insurance each have their own fee schedules. For example, if you are a car mechanic and you are selling brakes, your customer, whether they are a plumber or a physician, each one of them is going to pay you differently. Although plumbers make more than physicians, so I think they should get pay more. But anyways, that's another discussion. So Medicare pays for a service different than commercial insurance. And also the codes help to determine payment eligibility. Is the service covered under the patient's plan? So for example, if the patient is using an app or a medical device that is not covered, so they will not get paid for it. The reimbursement amount. How much will the payer reimburse for these services? And also patient responsibility. What portion of the cost does the patient owe in coinsurance or deductibles? But what are the challenges that we face today when it comes to the fee-for-service model? Although lots of physicians and hospitals still use the fee-for-service model, it doesn't really promote value in healthcare. Because in fee-for-service, you are very motivated to do more. Let's put it this way. Let's say a cardiologist see a patient, and this patient also is having some abdominal pain and diarrhea. The cardiologist knows that maybe this diarrhea is gastroenteritis and there is nothing to worry about. But because their friend is a gastroenterologist, they will call their friend and ask them, hey, like, do you want to see this patient? I will place a consult for you. So the gastroenterologist is going to come and see the patient because the gastroenterologists also want to make money because they want to live, they have family, right? So the gastroenterologist is going to come and see the patient for abdominal pain that is not needed. The medical knowledge that the cardiologists have is able to solve this medical problem or medical issue, and the cardiologist knows that this is just like abdominal pain or like a transient gastroenteritis. There is nothing to worry about, and we should focus on the patient's chest pain. But because they know the gastroenterologist, the stomach doctor, so they gave them a call and placed a consult. After the gastroenterologist come and see the patient, let's say for seeing the patient, they get paid $200. But for performing EGD, or what is known as scope procedure, esophagogastroduodenoscopy, which means inserting camera to the mouth to looking into the stomach, the gastroenterologist for this procedure gets paid $1,500. And they spend the same amount of time, or maybe a bit more, with the patient. But the value of money to time is much higher if they do procedures. So the gastroenterologist now is incentivized not only to see the patient, but also to do procedure. And maybe get some biopsies. Because if they do the procedure and do a biopsy, they will even get paid more. And even more biopsies, because if you do 2 biopsies versus 5 biopsies, you get paid more. And then they will send this to the pathologist who's going to look at the slides, and the pathologist also is going to get paid by the insurance or Medicare or Medicaid, or whoever is paying for the patient. So as you can see, it's just like it's a cascade of events. One thing lead to another. Although the gastroenterologist might not know the pathologist, but they are incentivized to take biopsies and send them to the pathologist because they're going to get paid more. And now the pathologist is going to also build a system. So the system is losing money here. Instead of taking care of patients, the system is paying for physicians, which is a not wrong thing. We want system to reward physicians, but also taking into account the value of care that they provide for patients. And that's where there is a shift toward value-based care. Recognizing these challenges in the industry, so more hospitals and providers are being rewarded for patient outcome rather than the number of the service they provide. Understanding these small intricacies of fee-for-service model and the coding system is important for entrepreneurs looking to innovate in this space, because although you might not be a physician who's being paid fee for service and you might not have that incentive, but also you have a device you want to get paid for. So as a healthcare entrepreneur, your ability to navigate and disrupt the traditional payment models that can lead to more efficient patient-centered care is very important. So by understanding these fundamentals, this will help you and help your company and help patients as well. Thank you for joining me on this talk. We covered fee for service and healthcare coding systems. I hope this episode has shed some light on this complex but essential aspect of healthcare finance. If you enjoyed this episode, please subscribe and share it with your colleagues. Stay tuned for our next episodes. We're going to cover other concepts in healthcare reimbursements. Until then, keep innovating and keep making a difference. See you in another episode of Delta.